Okay, here we have the tibia and fibula of the right leg. Okay. The tibia and fibula make up the lower leg, and the tibia is a medial bone, meaning it's closer to the midline of your body. It's also a weight-bearing bone. It bears the weight of your femur and the rest of your body. The fibula, on the other hand, is a lateral bone. Okay, it's located toward the periphery of your body. And what the fibula does is it's not a weight-bearing bone, but it serves as a point of muscle attachment for your leg. Okay? So we have the tibia, the fibula, and we'll look at the structures. We'll start with the tibia for now, and we'll start at the top. So here we have two condyles, okay? We have the medial condyle and the lateral condyle. Again, because this is the medial side, this is the lateral side, okay? And the medial condyle and the lateral condyle are separated by this bumpy structure here, and this bumpy structure is referred to as the intercondylar eminence, okay? Intercondylar eminence. Intercondylar because it's between the condyles. Now, you can see this rough surface just inferior to the condyles. This rough surface is called the tibial tuberosity, and the tibial tuberosity is going to serve as a point of attachment for the patellar ligament, okay? And that's in your knee. Now, this ridge here that runs along the length of the tibia, this ridge is referred to as the anterior border, okay? And the anterior border is actually the part of your leg that you bruise when you hit your shin, which is very painful. And going down here at the bottom, we have what's called the medial malleolus, okay? Medial malleolus. And the fibula also has a malleolus. In the case of the fibula, it's called the lateral malleolus, okay, because it's on the lateral side. And these two malleoli help make up the ankle joint, okay? So these two malleoli articulate with the talus of your foot. Now, the fibula, you can see this flat surface that runs along the length of the fibula. This flat surface is known as the lateral surface, and when articulated with the tibia, the lateral surface sort of faces laterally. It faces outward, okay? Going up the fibula, we have the head of the fibula, okay? And the head of the fibula has this pointy bit here. This pointy bit is the apex of the fibula, okay? So head of the fibula, apex of the fibula. And when the fibula is articulated with the tibia, the points where they attach are called tibiofibular joints. Tibiofibular, tibia and fibula, okay? The joint over here, this is closer to the center of your body, and so this would be a proximal tibiofibular joint. And this one, because it's farther away, would be the distal tibiofibular joint. Okay? And in terms of trying to figure out, okay, which part of the body are we in? You know, which side? Is this the left or is this the right tibia? Is this the left or is this the right fibula? Well, one tip that I have for you is if we look at the tibia, you want to look for the anterior border, because the anterior border, as the name suggests, is always going to be on the anterior side. And so you should see, if you get your tibia, you want to look for that ridge, that sharp ridge, and you know that that should face outward, okay? That should face outward. And you know that the tibia is a medial bone, And so it doesn't make sense for it to be here, right? To be here. So it's got to be on the right lower leg. Okay, so now we know that this is a right tibia. Well, what about the fibula? How do we know? Well, first off, it can be kind of confusing. Does it go this way or does it go this way, right? The way you can tell is that the head of the fibula is much shorter, okay, compared to the lateral malleolus, which is just generally more elongated, okay? So this is much more elongated. The head is a lot shorter, but it's got this pointy bit, which is the apex of the fibula, okay? So now we know, all right, it should go this way, but which way does it go? You know, how do we fit it in? Well, similar to the anterior border of the tibia, which always faces on the anterior surface, the fibula has a pretty similar ridge. Okay, so if we locate the lateral surface, it ends in a very pointy ridge, similar to the anterior border, and that ridge should face in the same direction as the anterior border. And so when we orient them so, we can easily fit the fibula into the tibiofibular joints, and they should articulate nicely like that. And so that's how you know that you have the right tibia and fibula. So in terms of bony structure of the tibia and fibula, that's really all you need to know.